Before we begin, this video is general health education, not personal medical advice. Your skin's thermoreceptors, tiny nerve endings, detect heat and cold, sending signals to your brain. This system works smoothly when healthy but may change with age due to nerve wear. If you notice sudden or severe temperature sensitivity, e.g., extreme hot-cold reactions without clear cause, consult the healthcare provider. They can help evaluate potential underlying issues during your appointment. Your skin has specialized nerve endings called thermoreceptors that act like tiny temperature sensors. Heat receptors fire above 42 degrees Celsius, 180 degrees Fahrenheit, while cold receptors respond below 15 degrees Celsius, 59 degrees Fahrenheit. With age, these nerves may degenerate or blood flow to the skin can decrease, slowing signal transmission and making extreme temperatures feel less intense. Always check with a doctor if sensitivity changes suddenly. Your skin has specialized nerve endings called thermoreceptors that act like tiny temperature sensors. When you touch something hot or cold, these receptors send rapid electrical signals to your brain via nerves. Your brain then interprets these signals, triggering reactions like pulling away from heat or seeking warmth. This system is highly precise in a healthy body, allowing instant responses to temperature changes. Temperature sensing isn't just about your skin, it's shaped by external factors like wind or clothing, and internal ones like blood circulation. Wind cools you faster by speeding up sweat evaporation, while thick clothes trap heat. Poor circulation, often linked to aging, can make temperature changes less noticeable. These factors don't always cause long-term issues, but can affect how your skin communicates with your brain about temperature. As you age, your skin's sensitivity to temperature can change, but you can help maintain it with gentle habits. Use lukewarm water for washing instead of hot or cold, and avoid extreme temperatures like ice packs or saunas. Wear breathable fabrics to regulate warmth without overloading your skin. Stay hydrated and moisturize lightly. Thick creams can clog pores and dull sensitivity. If you notice sudden changes like numbness or pain, check with a doctor. H1. Small, consistent habits keep your skin's temperature sensors sharp without overpromising results. Many people assume that changes in how skin senses temperature are always due to aging or illness, but that's not always true. For example, wearing thick clothing can trap heat and make you feel warmer, even if your skin isn't actually less sensitive. Similarly, poor circulation, which can happen with age, might make temperature changes feel less intense, but it doesn't mean your skin is broken. Some changes are normal, while others could signal something else, like nerve issues or circulation problems. If you notice sudden numbness or pain, it's worth checking with a doctor. H1. Small habits like using lukewarm water and wearing breathable fabrics can help keep your skin sensors sharp without overpromising results. If you suddenly feel numbness or pain when your skin senses temperature like burning or tingling, it's worth mentioning to a doctor. H1. These changes aren't always normal, even with aging. For example, poor circulation can make heat or cold feel less intense, but it doesn't mean your skin is broken. However, if symptoms like numbness appear without clear cause, a healthcare provider can help rule out nerve issues or other conditions. Small habits like using lukewarm water and wearing breathable fabrics can support healthy sensitivity, but they won't reverse age-related changes. As you age, your skin's ability to sense temperature can change, often because nerve endings slow down or blood flow decreases. This isn't broken, it's a normal part of aging. However, if you notice sudden numbness, burning, or pain when feeling heat or cold, it could signal nerve issues or circulation problem. These aren't always normal, even with aging. Small habits like using lukewarm water or wearing breathable fabrics can support healthy sensitivity, but they won't reverse age-related changes. If symptoms appear without clear cause, mentioning them to a doctor can help rule out other conditions. H1. Your skin's temperature sensitivity can also be shaped by what you eat, how active you are, and your environment. For example, staying hydrated and eating foods rich in omega-3 fatty acids like fish or nuts may support nerve health over time. Regular exercise improves circulation, helping your skin respond better to heat and cold. However, these habits won't reverse age-related changes. They just help maintain what's already there. If you notice sudden numbness or extreme sensitivity without a clear cause, mentioning it to a doctor can help rule out other conditions. H1. Science knows a lot about how skin senses temperature, but there are still gaps. For example, we don't fully understand why some people's skin becomes more sensitive or numb with age. It could involve nerve changes or circulation issues. While habits like staying hydrated, eating omega-3s from fish or nuts, and exercising support healthy nerves and blood flow, they won't reverse age-related shifts. If you notice sudden numbness or extreme sensitivity without a clear cause, mentioning it to your doctor can help rule out other conditions. But remember, research is still uncovering details, so what we know today might evolve with more studies. Maintaining healthy skin isn't just about looking good. It's also about keeping your temperature-sensing abilities sharp as you age. Staying hydrated helps nerves function better, while omega-3s, found in fish or nuts, support circulation, which can improve how your skin reacts to heat and cold. Regular exercise boosts blood flow, giving your skin the resources it needs. However, these habits won't reverse age-related changes. They just help you make the most of what your skin already does. If you notice sudden numbness or extreme sensitivity without a clear cause, mentioning it to a doctor can help rule out other conditions. Always follow label instructions for any over-the-counter medicines, and ask a pharmacist if you're unsure your skin's health is worth taking care of the right way. As you age, your skin's ability to sense temperature may change, but understanding these changes can help you stay informed and proactive about your health. If you notice sudden numbness or extreme sensitivity without a clear cause, it's important to discuss this with your doctor. They can help rule out other conditions and provide guidance tailored to your needs. Remember, research is always evolving, so what we know today might change with more studies. Embrace these changes with knowledge, not fear, and always follow label instructions for any over-the-counter medicines or ask a pharmacist if you're unsure. Your skin's health is worth taking care of the right way. Remember, this is general health education, not personal medical advice. For individual guidance,